You know that feeling, right? You see something online about pet health, maybe a friend's dog isn't well, or perhaps you've got a little worry about your own pet.
Yeah, and suddenly you're faced with terms like nasal tumors.
Exactly. And you just want the straight facts without needing a veterinary dictionary.
Yeah.
That's pretty much where we're heading today.
Right, we're taking a really focused look at a specific kind of cancer pets can get, chondrosarcoma. Specifically, the kind found in the nasal and paranasal sinuses.
Yeah, and we're using info from pasted text to kind of guide us through it, to really get to grips with what this means.
Think of this as like your express lane to understanding the basics.
That's it. Our mission here is just to pull out the key info about this cancer, what it actually is, who it affects, the signs, how it's diagnosed, and then treatment and outlook,
Keeping it clear, avoiding the really dense medical jargon.
hopefully. So let's kick things off. What is chondrosarcoma?
Okay, fundamentally, the text defines it as a malignant mesenchymal tumor.
Right, let's maybe break that down a bit. Malignant means cancerous, can spread.
Correct. And mesenchymal, that just refers to the type of tissue it starts in, sort of the body's connective or supporting tissues.
Okay. And a key thing is what it produces, this chondroid and fibrillar matrix.
Yeah, basically cartilage material. Think of the flexible stuff at the end of your nose. But crucially, the definition says it does not produce osteoid,
Osteoid.
the
Yeah,
stuff that turns into hard bone. And that distinction is really important for telling it apart from, say, bone cancers.
gotcha. And the text also mentions where it usually starts in the nose.
Yes, nasal chondrosarcoma, or CSA, most often pops up in the nasal turbinates.
Turbinates, remind me.
They're like these delicate, folded, bony structures inside the nasal passages. Their job is to help warm and filter the air your pet breathes in.
Ah, okay. And how common is this in dogs?
Well, the numbers are interesting. About 30% of all chondrosarcomas in dogs are found in the nasal cavity.
Wow, that sounds like a lot.
It does. But put another way, it only makes up about 15% of all nasal tumors in dogs. So yeah, it's serious, but it's not actually the most frequent type of nasal cancer they get.
And cats, is it the same story?
No, actually quite different based on what we have here. It's rare in cats. And unlike dogs, there's no specific breed or sex that seems more likely to get it in the few feline cases seen.
Okay, interesting difference. So focusing back on dogs, then who tends to get this? Are there particular breeds or an age range?
Right, so if we look at chondrosarcoma generally, not just nasal, the text mentions mixed breeds, Goldens, Boxers, and German Shepherds seem to be overrepresented.
Oh,
But for the nasal forms, specifically in dogs, the median age when it's diagnosed is around 8 years old, though the range is pretty wide, like 1 year all the way up to 15 years.
1 to 15, that's a huge span.
It is. And here's something quite telling the source points out. Nasal CSA tends to show up at a younger age compared to some other kinds of nasal tumors in dogs.
Huh. Why is that significant?
Well, it might suggest, a different biological process driving this specific tumor compared to others that usually affect older dogs. Could even be something researchers look into for, like, early detection clues.
So age can be a bit of a pointer then. If an older dog has nasal issues, it might be slightly less likely to be this specific type.
Potentially, yes. It's a useful detail for vets and owners, definitely.
So let's talk signs. If you're worried about your pet, what might you actually see?
Okay, the common historical signs, things you'd notice over time often include epistaxis,
Nosebleeds.
right, nosebleeds, could be one nostril or both, and maybe a mucopurulent discharge,
Meaning?
like mucus mixed with pus, bit unpleasant.
Yeah.
You might also see more sneezing than usual, noisy breathing, sometimes called stertorous, like a heavy snoring or snorting sound, and in some cases even a noticeable change in their facial shape.
A facial deformity. That sounds quite advanced.
It can be, yeah, as the tumor grows and pushes things around.
Are there less obvious signs maybe earlier on?
Sometimes. If the tumor starts pushing down into the mound, you might notice they're off their food, or they develop bad breath halitosis.
Okay.
And then, in more serious cases, if it extends back towards the brain, you could see really worrying things like seizures, changes in behavior, or just being really dull and unresponsive obtundation.
That sounds awful. What about when the vet examines the pet? What might they find?
Often, the vet's findings mirror what the owner saw, so they'll likely confirm the nosebleeds or discharge. They might test the airflow through each nostril and find it's reduced on one or both sides.
Right.
Gently pressing or tapping on the nose or sinuses might cause pain. The facial deformity, if present, would be noted.
And you mentioned eye changes too.
Yes, sometimes the eyes don't push back into the sockets normal. That's decreased retropulsion. Or they might even bulge outwards, which is exophthalmia, and maybe excessive tearing, epiphora.
Wow, okay. And the text mentioned something pretty dramatic they might see.
Ah, yes. Sometimes the mass can actually be seen bulging through the roof of the mouth, the palate, into the oral cavity itself.
Goodness. So that's the mass effect you mentioned.
Exactly. The tumor physically pushing on everything around it, causing all these different signs. Seeing it in the mouth is a very clear sign something significant is going on up in the nasal area.
So if a pet has these signs, what do we know about the causes? And how does a vet actually pin down that it is chondrosarcoma?
Well, first off, it's important to say the information we're looking at states that the exact causes and risk factors, they're currently unknown.
Right, so nothing specific we know triggers it.
Not based on this, no,
Hmm.
which is useful info in itself.
And diagnosis sounds like it involves ruling other things out first.
Definitely. There's a whole list of possibilities, what vets call differential diagnoses. Other nasal tumors like adenocarcinoma or squamous cell carcinoma are on the list,
Okay.
but also things like fungal infections. Different types affect dogs and cats. Even just a foreign object stuck up there needs considering, plus some rarer conditions.
Cool, lots to consider. What tests do they usually start with?
Standard blood tests and urine analysis are often normal, according to the source. But, and this is key, if there are nosebleeds, checking platelet counts is vital to rule out a bleeding disorder, like thrombocytopenia.
Makes sense.
The text also notes that just flushing the nose and looking at the cell's nasal flush cytology isn't usually very helpful for diagnosing these tumors.
Okay, so bloods might give some clues, but you really need to see inside.
Precisely. Imaging is crucial. Skull x-rays can be a starting point, looking for general signs like increased density where the tumor might be.
And chest x-rays too.
Yes, very important to check for spread, metastasis, especially to the lungs.
But for the real detail.
That's where CT scans come in. Computed tomography. They give a much, much better cross-sectional view.
What can they show?
They show the soft tissue mass clearly, any bone destruction caused by the tumor, and really importantly, whether it's pushing through that thin bone, the cribriform plate, into the brain cavity. The detail is just far superior to x-rays for this.
Right, so imaging shows what's there, but doesn't definitively say chondrosarcoma, I guess. How do they confirm it?
Good point. Imaging points you strongly in the right direction, but for the final answer, you need tissue. Checking the lymph nodes under the jaw, the mandibular ones, for cancer cells is part of staging, looking for spread.
Okay.
Then there's rhinoscopy, putting a small camera up the nose. That lets the vet see the mass directly, maybe see fungal plaques too, and it guides where to take a biopsy.
And the biopsy is the key.
Absolutely essential. Getting that tissue sample and sending it for histopathology, where a pathologist examines it under the microscope, is the only way to get a definitive diagnosis of chondrosarcoma.
And there was a critical safety note about that procedure.
Yes, really vital. The text stresses that the biopsy instrument shouldn't go further back than the inner corner of the eye, the medial canthus,
Why is that?
to avoid accidentally punching through that cribriform plate we mentioned and damaging the brain, a really crucial precaution.
Definitely sounds it. Okay, so once it's confirmed, what's next? What are the treatment options and the outlook?
Treatment-wise, our source points to radiation therapy as the main approach, the treatment of choice.
Okay.
Most commonly, that's done using a conventional linear accelerator. But it also highlights stereotactic radiation therapy, if available.
What's the advantage there?
It's more targeted, often means fewer treatment sessions overall, and potentially fewer side effects for the pet. So definitely something to ask about.
That sounds promising. What if the cancer is really advanced?
In those situations, palliative radiation might be an option. It's a lower dose, fewer treatments, really aimed at improving comfort and quality of life, not necessarily aiming for a cure.
Are there medications too?
Yes, supportive meds can help manage symptoms. Things like prednisone to reduce nasal stuffiness, phenylephrine nasal spray maybe for nosebleeds, and sometimes antibiotics if there's a secondary infection.
And how is the pet monitored after treatment?
Regular checkups are needed, typically physical exams every couple of months, chest x-rays maybe every 3-4 months to watch for spread or recurrence.
And more CT scans?
Possibly, yeah, especially if the clinical signs come back or get worse.
Right. And the big question, what's the prognosis? What does the source say about how things usually go?
Okay, prognosis. One bit of relatively good news is that this type of cancer doesn't tend to spread widely very often. The metastasis rate is less than 10%.
Oh, that's lower than I might have expected.
It is. If it does spread, the lungs are the usual place. But the survival time really depends on the treatment.
How so?
With only palliative care, Just managing symptoms, the median survival is unfortunately quite short, around 3 months.
That's tough.
It is. But with definitive radiation therapy, the outlook is significantly better. The median survival jumps to around 15 months.
15 months, okay.
And the chance of surviving for 2 years is about 30%. So radiation really can make a difference.
That's a substantial improvement. Does anything make the prognosis worse?
Yes, the source clearly states that if the tumor involves the brain, that's a poor prognostic sign. Which makes sense, given the location.
Right. And does it matter if it's in one side of the nose or both?
Interestingly, no. The text suggests that whether it's unilateral or bilateral doesn't seem to significantly change the overall prognosis.
So pulling it all together, it's obviously a serious diagnosis, no question. But it sounds like understanding the details, knowing about treatments like radiation, it offers real options, doesn't it?
Absolutely. It gives people valuable time with their pets and can maintain a good quality of life. Knowing the specifics, what it is, the low metastasis rate, the effectiveness of radiation, really empowers owners facing this.
Yeah, and for me, that point about it often appearing at a younger age than other nasal tumors in dogs,
Yeah,
that really stuck out. Such a specific detail, but potentially quite useful for a vet trying to figure things out early on.
it really underscores how important the whole picture is, doesn't it?
Yeah,
Age, signs, breed, all these little clues add up.
definitely. It makes you think, doesn't it? Seeing how crucial advanced imaging like CT is for diagnosing this and planning treatment. Where else in veterinary medicine are these kinds of tech leaps making a huge difference in understanding and treating other really complex conditions in our pets?
That's a great question to ponder. The technology is constantly evolving, and it's definitely changing what's possible in veterinary care.